A pregnant woman, a mother to be, a woman. In fact, everybody should watch this video. Every day in 2023, over 700 women died from preventable causes related to pregnancy and childbirth. A maternal death occurred almost every 2 minutes in 2023. Now, although between 2000 and 2023, the maternal mortality ratio dropped by about 40% worldwide. However, just over 90% of all maternal deaths occurred in low and lower middle income countries like Nigeria. Nigeria accounts for one of the countries with the highest maternal mortality rate. Approximately 1,047 deaths per 100,000 live births occurred in 2020. Although this has dropped down to 993 deaths per 100,000 live births in 2023, Nigeria still has a lot of catching up to do to reduce this significant burden by 2030, which is one of the Sustainable Development Goals to reduce the rate of maternal mortality by 40%. Now, the question is, why do these women die? These women die as a result of complications during and following pregnancy and childbirth, and this has been linked to the lack of birth preparedness and complication readiness among this group of women. So myself, Matthew Mirabel, and Dr. Eleke decided to conduct a study on the knowledge and practice of birth preparedness amongst pregnant women in Umuahia North local government area, Abia State, Nigeria. We wanted to find out if these women were ready to give birth and were also ready for the complications that came with giving birth. So birth preparedness and complication readiness is a World Health Organization endorsed intervention that encourages pregnant women and their families to plan for normal birth whilst anticipating actions needed in case of any complications. So we are going to check if they were able to identify a qualified healthcare provider for their delivery, whether they actually planned, saved money for delivery expenses and emergencies, whether they also made transportation arrangements and also had delivery materials. So we did a cross-sectional descriptive study amongst these women where we selected about 427 pregnant women, but we got about 393 valid responses, which was about 92% response rate, which is good. And we used a structured questionnaire to collect data during their antenatal sessions at the primary healthcare center. We looked at their social demographic characteristics, their obstetric histories, their knowledge, and then looked at their practice of this birth preparedness and complication readiness. Now, out of the women, we found that most of them were within the age group of 20 to 29 years, followed by 30% within the age group of 30 to 39 years. We also found that most of the women were married, and 47.8% of them had their education status were up to the university level. We also found that most of the women already had 2 to 4 previous pregnancies. We also found that they were self-employed and mostly traders within that target population. And of course, most of them were Christians, as we those in the southeast were majorly Christians. For concerning their obstetric history, 48.3% were in their second trimester, while 86.5% had no history of pregnancy complications. Then 56.2% had attended fewer than 4 antenatal care visits. We went ahead to check their knowledge, and we found out that about 50.4% heard of birth preparedness, which is just half that were aware of the concept of birth preparedness. Well, this is not surprising because Umuahia North is the urban part of Abia State. We found out that less than 50%, that's 46.3%, actually knew, 3 or more danger signs, which is alarming. Then 42% did not even know any of the components. Their key information sources were health workers, especially during the antenatal sessions, and you can find out that the percentage is really low. While 48.3% recognized the need to save money, and fewer mentioned arranging transport and identifying a blood donor, that's 12.5%, or planning for emergencies. This is alarming. We also looked at the practice of birth preparedness. 70.2% saved for delivery, typically around 11,000 to 100,000 for delivery. However, only 21.6% saved emergency funds for complication. 95.9% had already identified a health facility, which is really good because we made them in the primary healthcare centers, and most of them already signified. About 59% of them already said that they were going to give birth in the primary healthcare center. However, 67.9% also had arranged for transportation, looking at their personal vehicles compared to the commercial vehicles that they plan to use. Now, the saddest part is that 37.4% prepared a delivery kit. Anyway, this might be due to whether you're in your first, second, and third trimester, including baby clothes, baby items, and all that. We also found for emergency readiness, there was a huge gap for emergency readiness, and we found significant deficiencies among these women. Only 21.4% had an emergency plan for childbirth complications. Imagine that. 20.6% have only identified an emergency facility. Fine, you know you are going to give birth in this facility, but did you have another one in case an emergency comes up? Knowing where to go when there's a crisis. Also, 20.4% only knew about emergency transport access. When we are talking about ambulance and the rest, they didn't really know how to access this. 19.8% have already discussed plans with family, which is really low, because when it comes to giving birth, it is good to inform your family members so that they can help you in that critical point in time. And 8.7% were aware of community support local emergency system. Now, while 93.4% have had already identified a birth companion, looking at their husband as the primary companion, or their mother or mother-in-law, fewer than 1 in 5 had comprehensive emergency plans. You see where the problem comes from. Even though they were located in the urban side of Abia State, they still did not have a comprehensive emergency plan. Remember that these are the factors that contribute to the high mortality rate in our dear country, Nigeria. So for barriers to this birth preparedness, we found out that most of them stated financial constraint, that they did not have enough money to plan for birth preparedness or emergency readiness. Remember that most of them just planned between 11,000 to 100,000 naira. Then also distance to the facilities is also a problem. Lack of information too was a problem. Then the factors that influence this, meaning that these things are important things that we have to look at, is that tertiary educated women demonstrated 5 to 10 times greater preparedness, meaning that those that had gone to university were able to prepare better for complication compared to those who just had primary or secondary school certificates. Also, those with higher income, of course, strongly related to better practices, and those that had 4 to or more than 4 visits, antenatal visits, also significantly improved preparedness. That means the more you go for antenatal visits, the more aware of you about these complications and what to do about it. Parity, surprisingly, grand multi-gravida underperformed in emergency planning. That means those that had higher previous pregnancies, that 2 to 4 pregnancies, they underperformed in emergency planning, meaning that the more they gave birth, the lesser they were prepared to plan for emergency, because they are used to giving birth and we're now first-time mothers and all that. We also found that third trimester women showed better preparation. Of course, they are about to give birth, so they are better prepared compared to the first trimester and second trimester pregnant women. So what do we recommend? We recommend that antenatal care education should be intensified. Healthcare providers, those in the antenatal care centers, should educate these women and make sure that they are carried along very well. It's not just to come and talk and talk and talk. No, you should ensure that these women are paying attention. If possible, carry out quiz or tests to ask them whether they really understand what's going on. Also, community mobilization. We should deploy community health workers or go into the community and check for culturally appropriate sensitization campaigns in both the rural and urban areas. And also, you can see that tertiary education had a role to play. So we should encourage female education beyond the primary level. The more they go to school, the more I think they will understand all these things that we are talking about. And also target vulnerable groups, especially those in the rural area, those that are lower prepared for these birth complications. Also strengthening infrastructure. We should make sure that the facilities are well checked, are well provided for. The medicines and all that, they are well provided for, and we should not neglect especially those in the rural areas. Even though this study was conducted in Umuahia North local government area, the urban side, it doesn't mean that all the women there are aware of this birth preparedness and complication readiness, like we saw in this study. So strengthening birth preparedness initiative is essential for improving maternal and of course neonatal outcomes in this setting, in this local government area. While fair knowledge exists, significant gaps remain in practice, especially in emergency planning and resource availability. So that is what we found in our study. Therefore, we conclude that if you are about to give birth, be well prepared for anything. Wait, before you go, if you want the link to this paper is in the description box below. And if you like us to conduct any other research, leave a comment in the comment box below.